Hello and welcome to another Talk to Stu with me, Stu Magoo. In this session we are going to be talking about NHS continuing healthcare. What is it? Does it apply to you? And what are the pitfalls? So first of all, let's have a quick look at the difference between NHS continuing healthcare or nursing care and care. Okay, so it may well be that you are receiving care currently. Care is defined as support with daily living activities. So this could be eating, drinking, getting in and out of bed, changing your clothes, having a wash, using the toilet, things like that. Okay, so this is care. If somebody supports you with doing these things, then they're providing care services to you. However, healthcare or nursing care or medical care is something quite different, and that's where NHS continuing healthcare comes in. If a person, for example, has been into hospital for a length of time, it might be a long period of time, it might be a short period of time, and they, after a certain while of being in there, the hospital decides, or the doctors decide, that this person can't really be treated in any further way within the hospital, but that their health conditions and medical support can continue or should continue outside of the hospital environment to enable them to recover or rehabilitate or just manage their conditions. If they decide that this is the case, then they will look at putting that person into NHS continuing healthcare. So what we commonly know as NHS continuing healthcare is a person going into a nursing home. So a nursing home is basically a home, a care home that has a nurse on staff 24 hours a day who is able to administer certain things that people with medical needs would need. So it might be, for example, intravenous injections, a person being on a drip. It might be support with changing dressings. It could really be anything. What's important is that if you are qualifying as needing NHS continuing healthcare, that the NHS will pick up the tab for any of your care costs while you're receiving this care. So if you're in a hospital and they decide you need NHS continuing healthcare and you need to go into a nursing home to receive it, then they will put you in that nursing home and they will cover all of the costs for the duration of your stay while you qualify as having NHS continuing healthcare. But this is where it gets tricky. NHS continuing healthcare isn't a permanent thing. It's often put into place for very short periods of time. The general timescale is that the continuing healthcare needs to be reviewed every 3 months at the latest. Sometimes people are reviewed more often or sooner than that. So if a person, for example, or a patient has some kind of severe ulcers on their legs which have been treated, the infection's gone, but they have to have the wounds, the dressings on the wounds changed, say, more than 2 or 3 times in a day, more than a district nurse would be able to provide with a daily visit, then it might be seen that this person's best off in a care home where a nurse can come around and check on that quite often to make sure no infection returns and to make sure the dressings are changed. Now at some point it may be that that wound heals up and that it requires no more dressings and no more attention from a nurse. Now at that point, NHS continuing healthcare will stop, and that means that if that person still requires care, as we defined it earlier, support with washing, dressing, food, getting out of bed, going to the toilet, that sort of thing, if they still require that care, they then either have to move into a care home, or if the care home that they're in provides nursing and care support, then it may be that they just no longer have the nurse coming to visit them. Either way, what that means is that that person is then responsible for paying for their own care. Now, as we've discussed in my other video, there's lots of different ways that care can be paid for. an individual is responsible essentially for paying for that, but often it's family members and carers and so on that sort that out for them. Social services often do a financial assessment and will provide some, if not the lion's share, of the funding that a person needs to reside in a care home. It may well be, of course, that a person is able to go back into their own home and receive care there, which would keep them going, and actually they don't need to be in a care home. Again, that funding can either be, if you qualify, if you're eligible, supported by social services, or something that you would pay for yourself as a self-funder. The problem is, though, when somebody's gone through having NHS continuing healthcare and they get better, quite often they get unwell again. And so what can happen is we get a bit of a sort of revolving door of people with a health problem that present a health problem, go into hospital, have the treatment, get sent into a nursing home, receive NHS continuing healthcare, recover to a certain extent, and either go into a care home or back to their own home, where maybe that health problem reoccurs, and they end up going back into hospital, back into nursing care and so on. And it goes round. The other thing is some people may not have recovered as well as the family or social services or even the care home would like before the assessors for the NHS continuing healthcare have decided that actually they don't need to provide that anymore. It may be, if we take the example of somebody receiving dressings again, that actually in the latter week or two while the wound is almost healed up, that the nurse who's attending feels that, instead of changing the dressing 3 times a day, it only needs to be done once a day, and that could be done by a district nurse. Well, at that point, NHS Continuing Healthcare is going to say, well, we're no longer going to fund this. That person needs to go back into their own home and have a daily visit from a district nurse. Well, as we all know, district nurses don't grow on trees, and getting an appointment and getting on the list to be seen, and even getting seen regularly, is a lot more challenging these days. On top of that, a person might still be quite frail and not able to look after themselves at home, or they might be at a high risk of falls, or whether they're at home or in a care home. And it might be that the social workers, the care home, and even the family don't think that that person should stop receiving NHS continuing healthcare. Now at that point, if you're the family member and you're supporting that person, you'll find social services tend to be a good ally in that situation. They often will support you with challenging that or having a reassessment through the NHS to continue with the continuing healthcare. However, it might well be that that person is well and you feel that, they could do with going into care rather than being in a nursing home. So then you might find that actually social services aren't quite so much of a friend at that point, and that the NHS actually is the people that's supporting you with that. Because at the end of the day, it's all about the money. So social services don't really want to have to pay for care. The NHS also really don't want to have to pay for nursing care. So if there's an opportunity to get out of doing so, then they will try and do that. Now, that doesn't mean that an individual social worker or an individual nurse or doctor specifically says, oh, I don't want your parent to have to, for us to have to fund your parent's day. They might not personally be thinking that, but the whole system behind them is set up in that way. So it might not be personal, it might not be the specific social worker who's saying, well, we don't want this person to go into care, there's not enough beds or anything like that. They're essentially the person just doing the job at the end of the day. So it can be quite an unpleasant and difficult time for all concerned. NHS continuing healthcare and the way it's assessed is very complicated. There is a lot of guidance online, and I'll pop some links in the box below so that you can find out more details about it. And essentially it's nothing to be too fearful of, but it can have some complications. So do read and understand as much as you can, not only about NHS continuing healthcare and how those assessments work, but also about the person that you're caring for, or even yourself, and the health conditions that are in play at the time. NHS hospitals do get charged if people are readmitted too quickly, or sort of, not exactly charged, but suffer kind of punitive, charges really. So generally speaking, they don't want people coming back into hospital too quickly, and it is, better for everybody all around if people don't. So it's important that they get it right at the early stage. If you feel that they are not assessing a person's medical needs in the right way, then it's important to challenge that. But you must remember, not all needs that a person has when they are at this time of life are medical. They might seem like they are to you, and arguably they are. But the reality is, or certainly the way it's viewed in our system in the UK, is that actually these people only require care support. So quite often you can find that you're fighting with the wrong people to try and get the right support for your loved one. It's best in those situations to try and take as much advice and guidance as possible. You may have an Age UK nearby who can give you a little bit more guidance on this subject specific to your situation, if you're able to sit down and have a chat with them. They tend to be quite well informed on this area. Equally, there are a number of helplines that can guide you as well. Try and get as much information as possible, and do remember that everybody involved, generally speaking, face to face, the people you encounter all want what's best for your loved one. If you feel that a mistake has been made, try not to get angry and shout at everyone, as tempting as it can be in certain situations, because generally you get more flies with honey. That said, don't let people push you around. If you feel that something really is wrong, do make a complaint. Use the Patient Advice and Liaison Service, or whatever it's called these days, to the Patient Relations Team in Worcester, to make a complaint if you feel that it's not being administered correctly, or that the patient, your loved one, isn't being looked after properly. Equally, if social services aren't doing things that they should be doing, or representing you in the right way that is customary in this situation, then again, talk with them. Often an NHS assessor or a social worker can turn up at a care home without you being aware of it, even if you're lasting power of attorney. They don't feel that they necessarily need to get in touch with you for you to be there at that point in time, and that can be very distressing. But if that does occur, and you should have been, don't be afraid to make a complaint about it. At the end of the day, and it's sad to say it, it's those who speak up the most or shout the loudest that get the best service. So hopefully this has been some kind of guidance for you into NHS continuing healthcare, and that you'll have a bit more of an idea of how that might apply to you. If you feel that you want more information, or if you've had experience of this and you want to share your experience with other people, then please drop comments in the boxes below. Obviously, I can't answer every comment, but I will try and do my best to do so. And of course, please do be respectful. At the end of the day, we all have different experiences of these kind of things, and if we support each other, we can all get through it a bit more easily. And it may well be that your experience actually is a benefit to other people. So please be courteous and let us know your thoughts and your experience as well. Thanks again for watching, and I look forward to seeing you all again in the next video. If you've got any particular subjects that you want us to discuss, do drop those in the comments as well, or send me a message. It's always good to get as much information as possible. So, and most importantly, don't forget to like, share and subscribe if this video was useful to you, because that helps me to keep on making these. So yeah, thanks for watching, and see you soon.